Hi, I'm Dr. Rasya Dixit from Dr. Dixit Clinic, Bangalore. Today we are talking about the most important thing that is there in his man's life, and that is his crowning glory. We are talking about male pattern hair loss. The most common cause of hair thinning in men is the male pattern or the genetic hair loss which is experienced by most men. So why do men have this male pattern hair loss? 90% of the hair loss is because of genetics. Most important hormone in men is the androgen testosterone. In its active form, dihydrotestosterone or DHT as it is known, is going to go and act on the androgen receptors which are present in the man's scalp and make the hairs to grow thinner and shorter and fall out faster. This is called miniaturization, which happens mainly in those men who have a strong genetic history for male pattern hair loss. That means if your father or your grandfathers or your maternal or paternal uncles were predisposed to balding early, you may also have a highly likely chance to start balding early. This balding process was usually seen in the late 40s. But as the generations have increased and we see that the increased stress, increased chances of smoking, use of junk food, as well as increased obesity, we are seeing earlier onset of male pattern hair loss. Features like vitamin deficiencies, COVID infection could also push you to start balding earlier. What are the signs that you see in these balding patterns? First thing that the man may notice is a bitemporal hair loss or a bifrontal hair loss, which is there in the frontal hairline. The hairline starts to recede. The M pattern, the deep M pattern is established. Then you may notice a crown thinning as well, where the vertex of the head, the scalp starts to thin out. Then there is a diffuse thinning of the whole crown area. Usually the occipital area or the back of the head is spare. Why is this so? It's because the back of the head, the occipital area, is devoid of the androgen receptors. So what is this androgen receptor? This is something which is present in the root of your hair, which makes the dihydrotestosterone react with your scalp. And it is passed on in a genetic fashion. So if your father or your grandfather were having balding early, you are likely to have more androgen receptors in your scalp. That means you also start balding early. The reason why I am mentioning all these terms, dihydrotestosterone, androgen receptor, is when we start talking about the therapeutics or how to treat male pattern hair loss, we will be talking about DHT blockers, we will be talking about androgen receptor blockers, and this is why I am talking to you about these terminologies now. So in male pattern baldness, once the thinning has started to occur, you start to see that the hairs not only become tinier, they become thinner, they become more brittle, they tend to fall out very fast, they don't stay in the scalp, and over a period of time they are replaced by scarring tissue, that is the shining that we see on the bald man's scalp. So once this shining scalp is visible, after that it becomes very difficult for us to regrow the hair and we have to go for hair transplantation. Which is why whenever we see male pattern baldness patients, we tell them treatment early is always advisable. If you think that you are having a frontal recession or your scalp is visible, I think it is time for you to consult a dermatologist, understand what are the things that could be making your hair loss worse and work on them along with them in order to keep your crowning glory in its place. Thanks for watching and keep watching and following us for more tips on male pattern hair loss.